Breastfeeding is a beautiful experience. It is a time when a mother and her baby can connect on a deeply emotional level. The act of breastfeeding is not just about feeding, it is about nurturing and providing comfort. The closeness and warmth shared during these moments are irreplaceable. It creates a special bond between mother and baby. This bond is built on trust, love, and the mutual need for each other. The baby feels secure and loved, while the mother experiences a profound sense of fulfillment and purpose. The eye contact, the gentle caresses, and the rhythmic suckling all contribute to this unique connection. Breast milk is the perfect food for babies. It is tailored to meet their nutritional needs and is easily digestible. Breast milk contains antibodies that help protect babies from infections and illnesses. It is a living substance, constantly changing to meet the growing needs of the baby. The benefits of breastfeeding extend beyond nutrition. It also promotes healthy growth and development. It provides all the nutrients they need. From proteins and fats to vitamins and minerals, breast milk is a complete source of nourishment. It supports the baby's immune system and helps in the development of their brain and body. The content look on a baby's face while breastfeeding is a testament to the satisfaction and comfort they derive from it. But breastfeeding can also be challenging. Many mothers face obstacles. These challenges can range from physical discomfort to emotional stress. It is not uncommon for mothers to feel overwhelmed and unsure of themselves. The journey of breastfeeding is filled with ups and downs, and it is important to acknowledge and address these difficulties. This guide will help you overcome them. With the right information and support, many of the common challenges can be managed effectively. Whether you are a first-time mother or have breastfed before, this guide offers valuable insights and practical tips to make your breastfeeding journey smoother and more enjoyable. This guide will discuss common breastfeeding challenges. We will explore the various issues that mothers often encounter and provide solutions to address them. From understanding the basics of breastfeeding to dealing with specific problems, this guide aims to empower you with knowledge and confidence. We will talk about sore nipples. Sore nipples are a common issue that many mothers face, especially in the early days of breastfeeding. It can be caused by improper latching, frequent feeding, or even an infection. We will discuss ways to prevent and treat sore nipples, ensuring that you can continue breastfeeding comfortably. We will cover low milk supply. Low milk supply can be a source of anxiety for many mothers. It is important to understand the factors that can affect milk production and how to boost your supply naturally. From using breast pumps to incorporating certain foods and herbs into your diet, we will provide you with strategies to increase your milk supply. We will also discuss latching problems. A proper latch is crucial for effective breastfeeding. Latching problems can lead to discomfort for the mother and inadequate milk intake for the baby. We will guide you through the steps to achieve a good latch and offer tips on positioning and techniques to make breastfeeding more comfortable and efficient. You are not alone in this journey. Many mothers have walked this path before you and have successfully overcome the challenges. Support groups, lactation consultants, and other resources are available to help you. Remember, breastfeeding is a learning process for both you and your baby. With patience, persistence, and the right support, you can navigate this journey with confidence and joy. Many mothers experience breastfeeding challenges. Sore nipples are common. Latching problems can be frustrating. Low milk supply is a concern for many. Don't worry, there are solutions. We will discuss practical tips. These tips will help you overcome these hurdles. Remember, support is available. Lactation consultants can provide expert guidance. Sore nipples are a common complaint in the early weeks of breastfeeding. Many new mothers experience this discomfort, which can make the breastfeeding journey challenging and stressful. The main cause is often an improper latch. When the baby doesn't latch onto the breast correctly, it can lead to significant pain and even damage to the nipples. When the baby doesn't latch correctly, it can cause pain and discomfort. This improper latch can result in sore, cracked, or bleeding nipples, making each feeding session a painful experience. To prevent sore nipples, ensure a proper latch. A good latch means the baby's mouth covers a large portion of the areola, not just the nipple. This helps distribute the pressure more evenly and reduces the risk of soreness. The baby's mouth should cover a large portion of the areola. Use a nipple cream. Nipple creams can provide much-needed relief by soothing and protecting the sensitive skin around the nipples. Nipple creams soothe and protect the nipples. They create a barrier that helps to heal and prevent further irritation, making breastfeeding more comfortable for both mother and baby. Ask a lactation consultant for help with positioning. A lactation consultant can provide personalized advice and hands-on assistance to ensure that both mother and baby are comfortable and that breastfeeding is as effective and pain-free as possible. With the right support and techniques, breastfeeding can become a rewarding and pain-free experience. Remember, seeking help early can make a significant difference in your breastfeeding journey. Low milk supply can be worrisome. You might notice infrequent feedings. Your baby may not be gaining weight. Stress can impact milk production. Certain medications can also affect supply. Underlying health conditions might play a role. To increase milk supply, try frequent pumping. A lactation consultant can offer personalized advice. Section 5. Perfecting the latch. A guide for mom and baby. A proper latch is crucial for comfortable breastfeeding. If you experience pain, your baby might not be latching correctly. You might hear clicking sounds during feeding. A lactation consultant can help correct the latch. They can show you different techniques. Positioning is key. Make sure your baby is comfortably supported. Section 6. Overcoming engorgement. Tips for comfort and relief. Engorgement happens when breasts become overly full of milk. It can be uncomfortable. It can make it difficult for the baby to latch. Frequent feeding is key to managing engorgement. Apply warm compresses before feeding. This helps with milk flow. Gently massage your breasts to encourage milk drainage. Section 7. Dealing with mastitis. Recognizing symptoms and seeking help. Mastitis is an inflammation of the breast tissue. It can be very painful. You might experience flu-like symptoms. If you suspect mastitis, see a doctor immediately. Antibiotics are usually needed to treat the infection. Continue breastfeeding or pumping. This helps to clear the infection. Section 8. Tongue tie and lip tie. Identifying and addressing the issue. Tongue tie and lip tie can affect breastfeeding. These conditions restrict tongue movement. This can make latching difficult. If you suspect tongue tie or lip tie, consult a healthcare professional. They can assess the condition. A simple procedure can release the tie. This will improve breastfeeding. Section 9. Balancing work and breastfeeding. Strategies for success. Returning to work can be challenging for breastfeeding mothers. You need to balance work responsibilities with pumping. Talk to your employer about your needs. Invest in a good quality breast pump. Create a pumping schedule that works for you. Section 10. Finding support and resources. You don't have to do this alone. Remember, you are not alone in this journey. Breastfeeding can be a challenging experience, but it's important to know that there is a community out there ready to support you every step of the way. Many resources are available to support breastfeeding mothers. From pamphlets and guides to online forums and local support groups, there is a wealth of information and assistance at your fingertips. Lactation consultants are breastfeeding experts. They have specialized training to help you and your baby establish a successful breastfeeding routine. Whether you're facing latch issues, milk supply concerns, or just need some reassurance, they are there to help. They can provide personalized guidance tailored to your unique situation. This one-on-one support can make a significant difference in your breastfeeding journey, offering you the confidence and skills you need. Support groups offer a safe space to share experiences. Connecting with other mothers who are going through similar experiences can be incredibly comforting and empowering. These groups provide a platform to share tips, ask questions, and offer encouragement. Online resources provide a wealth of information. Websites, blogs, and social media groups dedicated to breastfeeding can offer valuable insights and support. You can find answers to common questions, read about others' experiences, and even connect with experts virtually. Don't hesitate to seek help when you need it. Whether it's through a helpline, a healthcare provider, or a trusted friend, reaching out for support is a sign of strength. Remember, you don't have to navigate this journey alone. There are many people and resources ready to help you succeed.